Welcome back. This is Debbie here with Think Healthcare Solutions. And the first thing I'm going to talk about is our healthcare expenses and the cost. So there are companies out there that will review your bills, but usually they're looking at the higher dollar bills, and they can cost a significant amount of money. Now, the downside is, if that $200,000 bill is correct, and there's not too much you can do, that maybe negotiate it down a little bit, but you could be out a significant amount of money. Whereas our services for the monthly fee, it's all included, that we do that no matter the bill. And having said that, the other problem with hiring a company to audit a high dollar bill, or maybe an encounter, maybe you're hospitalized for something significant, that's all fine and good, but think about this. If you have someone that you go to the doctor, you take a picture of the bill, submit it, when your insurance company pays on it, you submit it, we look at it, we make sure everything's fine, and that's all housed. We do a reporting of all of your expenses. And yes, you have that available to you through your insurance company. They'll have the portal for the patient. All that's great. But let's say you change jobs in the middle of the month. Let's say your your employer changes plans at some point. That all changes. Everything changes. But what doesn't change is you stick with us. We follow through with you, and it becomes second nature. Instead of waiting for big bills to come along, we look at everything. And I can tell you that it's not just the big bills that have problems. 85% of all medical bills have errors. And on top of that, there can be errors after the fact. And let me give you a couple of examples. First off, we have a 3-year-old that's got an upper respiratory thing going on. Patient goes to the doctor and is sent over to the hospital for a chest x-ray and some lab work. Bill comes back, it's $3,000. The insurance company processes it. It's at the beginning of the year. There's a lot of out-of-pocket expense. But lo and behold, the client sends the picture of the bill, sends the picture of the EOB, take a look at it. We find out the actual orders, and come to find out there are 4 charges on that bill that should not be there, and they were billed without an order. Therefore, they're not a valid charge. And come to find out the hospital has a bundle that the big charge triggers the other charges along with it. But it shouldn't have been billed. Had that patient been done at the local lab, then that charge wouldn't have been there because it wasn't ordered. So that was $800 on a simple chest x-ray and lab. Yes, the primary lab that was ordered was a high price cost, but there were 4 other charges that shouldn't have been there, and it was $800 that the patient would have had to pay out of pocket. Okay? Next example, patient has an in-office procedure, just a simple, let's say it was a knee injection for knee pain. This is a Medicare patient. Medicare's billed, Medicare pays it, and almost a year later to the day, the patient receives a bill for that encounter for the amount that Medicare paid, because someone in the office inadvertently reversed the charges on his account. Now, what do? This was an older person, and if our parents of that age, a lot of times they'll just pay and not even think about it. Well, they may think about it, but they're like, oh, well, I guess I didn't pay it, and they'll pay it. So there's a lot of, and that's $300 that I'm sure he didn't have. So why not have someone that's in your court keeping track of everything and keeping you on the straight and narrow, and you're not having to pay any more than you absolutely need to. There's other corners that can be cut, and that's what we're here for. And that's a whole nother explanation. But this day and age, we have high dollar insurances. We have share plans that have limited allowable, as well as, a significant out-of-pocket expense. And back to the insurance companies, this day and age, we have such high deductibles and a lot of out-of-pocket expense that it can become a nightmare for you, the consumer, and you are paying, sometimes you're paying more than your deductibles and your out-of-pocket expenses are supposed to, because of the climate of how facilities bill, how facilities, a lot of their balance billing still to this day, and in crazy order. A lot of times they can't really go after anything that's denied. Yes, insurances have auditors, and yes, some facilities have auditors, but they're doing totally different than what us old-timers that have been around a long time are doing. And a lot of them aren't as seasoned and really don't even know their job. And I can vouch for that, being my associates over and over again, as an external auditor helping a facility, time and time again, their auditors were clueless. Or they were driven to just look with their blinders on at certain things. Which leads me to my last example, and probably one of the more significant examples. Let's say that you've gone to the emergency room for something. It could be something you could have hurt yourself, you could be very, very sick, it doesn't matter. But let's say during that visit you were seen, you might have had a CT scan, you might have had some lab work, they might have started an IV on you, and maybe you're getting some fluids, you've gotten some medication by IV, maybe they've given you an antibiotic, maybe something for pain, maybe something for nausea. I could go on. Now, in the emergency room and an outpatient arena, they are allowed to bill for IV and medication administration. Okay? So, and a lot of times what happens is, let's say you were given some IV fluids, over 100 cc's an hour for an hour. And in that time you were given maybe something for pain, maybe something for nausea, and I don't know, some other random drug. So they bill for the medications, they bill for the IV fluid usually, or some other kind of charge for that. And then they can bill for the hour of hydration and any of the medications. If the medications were given at the very same time, they can only bill for one administration. If they were given at least a minute apart, then they can bill for two. So, and a lot of times what happens is, you get your IV, everything gets ironed out, the doctor reviews your situation and has a discharge plan in place, and then you're discharged. Now, a lot of things can happen. Nurse could have another bag ready for you, but they didn't really hang it. So let's say you got the fluid, you got the hour of hydration, you got 2 medications, and on your bill there is 2 bags of fluid, 2 hours of hydration, and the medications. Now, I would come along and look at that bill. We would have a discussion, maybe ask you a few things. If we don't have a clear picture, then we would get the notes and review and make sure that yes, you got that 2nd bag of fluid. If you told me no, then we're on a good roll. But anyway, needless to say, you could be looking at potentially maybe $400 overbilled if that 2nd bag wasn't given and if that 2nd hour wasn't given. A lot of times they're billed, the administration can be attached to the bag of fluid, or some other way that they've targeted and billed for that. And it just depends on how they do their charges. If people review it, great. If not, then you're open for errors on your bill. The other thing is if there's no stop time for that hour, then they don't get that either. They would have to have a stop time in order for that bag to be the infusion administration would have to be documented. So there's a lot of things on a relatively small bill. I mean, an ER visit can be very pricey in and of itself. The other thing is the level of care. There's a couple of things that can happen because you'll get a bill from the hospital and a bill from the emergency room doc. If those 2 bills aren't coded for the same level of care, insurances like to bounce those off and don't get them paid. And of course, most times, the emergency room physicians are not attached to the hospital and they never communicate, and a lot of times that doesn't get resolved and it comes back to you, the consumer, as they're not paying and there's nobody there to help you. So those are 3 very simple examples. The other thing is the CT scan. If a lot of times, sometimes they'll bill the wrong like CT scan if you didn't get contrast, and if the prices vary. Sometimes the charges are the same, but sometimes they're not. And there's always all kinds of little things that we can hone in on that a lot of folks aren't tuned into. So there's a lot of different things and reasons why a bill can be wrong. So it's just very important that why not have someone here? Your bill comes in, you scan it, we look at it, we watch for the bill, the explanation of benefits from your insurance company, we review it, and if it all checks out, then it's a good bill, then you're good. If it doesn't, then we fight it for you. You don't have to think about it. You don't have to fret over it, and you hear from us and know what to expect. At the end of the year, you'll get a printout or a file that you can take and use with your taxes, and everything's seen through to the end. So it's a very inexpensive way to have someone in your court, along with all the other benefits that we offer here at Think, that you'll learn about. So why not have a consultant in your pocket, just like the hospital and the insurance company, for a minimal amount of money for you to not have to worry. So check out the next section, and we look forward to seeing you on the inside. Also, we do the same thing would hold true for your vet bills and stuff for your pets. I meant to mention that.